Zoom recording. All right. I am now recording. So thanks everyone for participating in that icebreaker activity. We're really excited to turn the time over for our learning session today to Alex. And she's an assistant professor in the Department of Counseling at ISU. She has done a plethora of things that have made her the experience, given her the experience that she has that she's going to be sharing with us today. And I love that in her introduction here, she highlights that her research interests are counselor preparation to assess and address clients' social determinants of mental health needs, and then also how to enhance cognitive complexity and how richly counselors think about their clients. She is really committed to interdisciplinary research efforts, and she's demonstrated that by her involvement with some of the things that we've been putting together for our behavioral health workforce training efforts with our new grant. And all of those things have been able to improve mental health access and outcomes in rural areas. And with her today, we also have Bella Colson, who's a licensed professional counselor in Idaho. She's currently a doctoral candidate in counselor education and supervision here at ISU as well. So I'll turn the time over to them. I'll let you share your screen, Alex, and we're excited to learn from you guys.
Wonderful. Thank you so much for those kind introductions. It's really excellent to be with you all today. All right, I think you can let me make sure my notes are up here. Let me reshare this really quick. There we go. Now you can see my slides. All right. Well, like I was saying, it's a pleasure to be with you all today. Bella and I are excited to talk with folks. I think those intros are kind of a long-winded way of saying that Bella and I spent a ton of time talking to counseling students all week long about how to talk to and interact with clients and what all of that means. And so it's always a pleasure to talk to folks out in the community who are doing the work. So thank you for giving us some of your afternoon today. Give you a little bit of an overview of how we will spend our time together today, and more specifically, what we hope you're able to do by the time we wrap up our short time together today. One, we'll talk a little bit about a holistic, multidimensional view of mental health. Someone had mentioned active listening earlier when we were playing this like word building, sentence building game. And I was thinking, perfect. Yes, we're going to talk a little bit about active listening today. We really hope we can focus in on some actionable ways to engage with the clients that you work with and broach and talk about things that might be difficult. And part of that is also focusing on reflecting the feelings that other people are experiencing. And then we'll wrap up our time today by sharing some community resources with one another. And so I'm going to I'm going to ask a little bit fewer questions than I normally do when I'm engaging in these kind of presentations. But that's really just so we can get to some of the more interactive pieces we have toward the end of our time together. So starting out here, what is mental health? This is such a giant question. Even as someone who's a mental health professional and spends all my professional time at least thinking about and talking about mental health, I think it's a challenge in some ways to not conceptualize, but maybe define and operationalize such a large construct. And so I'm going to put up a couple different definitions here of mental health, and I'll give you a couple seconds to read these. I'm curious as you look through these, is there anything that stands out to you? Feel free to, I have the chat open here. Feel free to use the chat or, of course, unmute yourself. What stands out? What do you notice? I think for me, one thing that stands out is the multi-dimensionality of mental health, especially with this last one here. I think of the emotional side of things, psychological, which makes me think of our ways of thinking or making sense of information in the world, and also that social aspect. I see someone in the chat said well-being. Absolutely.
Yeah, I was also going to say well-being because it's not just illness or like, but it's also got the positive aspects of good health, I guess. Love that word.
Absolutely. Yeah. Thank you. And that'll come up again. I think that's a really important point. Not just having a deficit perspective, I think, on mental health, but focusing on that wellness aspect, and the strengths and resources that folks do have. I also want to highlight too, being able to a state of well-being that enables people to cope with stresses, realize their abilities, learn and work well, contribute to their community. Do people have the resources and abilities and ways of being that allow them to accomplish the things that they want to accomplish and interact with others? So anyway, a part of overall health, there's multiple ways of defining mental health, and so I hope the thing that stands out, if anything, right, is the multidimensionality of mental health. I also want to highlight that everyone has mental health in the same sense that everyone has physical health. There's been a number of several clients that in my own work that kind of stand out as like I even saying as directly as I don't have mental health, not for me. And there's a number of different cultural factors, ways of growing up, et cetera, that can lend someone toward thinking like that about mental health. But if we apply that same kind of way of thinking to physical health, right? You wouldn't say like you don't have physical health, even if you're not sick per se, right? There's still some level of physical health that we all have. And so I think normalizing mental health in that sense is an important thing to highlight. And of course, this is not a particularly novel idea, right? But everyone has a unique experience of their own mental health and how they make sense of that construct. So I think that's another important thing to keep in mind. And again, just like Ryan was highlighting there, mental health's not necessarily just the absence of dysfunction or pain or illness, but the presence of well-being. If we go back a little bit to that last, I'll just show you this definition here. The World Health Organization defines well-being as a positive state and resource that encompasses quality of life, the ability of people and societies to contribute to the world. And I think this is really powerful and something that we can easily and understandably lose sight of, but a sense of meaning and purpose. To me, when I read that, there's a kind of a heft to it. Something significant about that, moving about the world, not just to meet our basic needs or those of our family or whoever we take care of, but to have a sense of meaning and purpose. That's to me a very significant aspect of this. So, I'm not sure if anyone's familiar with the WHO 5 Well-Being Index created by the World Health Organization. Very, very brief measure of wellness. Only 5 items. It's been validated in over 20 languages. You can use it with folks who are 9 and older, so a lot of people. And like I said, it's just essentially a measure of well-being. And I wanted to show you all this just so you can kind of add it to your toolbox, so to speak. But I think it also is kind of a nice, really brief, digestible uh, operationalization of well-being. So you can see 5 items here. When folks complete the WHO 5, they're considering the last 2 weeks. And that's a piece when I talk to counseling students about assessment. Sometimes clients will complete an assessment without reading those directions up there. And so you'll ask someone like, are you feeling down and depressed? And they'll say, yes, 10 out of 10. You go and ask the client about it, and they're like, oh, that was 20 years ago, not right now. So I always like to highlight too, this one's focusing on the last 2 weeks. But take a second and look at these 5 items here. If you're trying to assess someone's level of well-being, at least according to the WHO 5, these are the items they came up with. So have you felt cheerful and in good spirits, calm and relaxed, active and vigorous? Do you wake up feeling fresh and rested? And the last item here, daily life has been filled with things that interest me. Anything kind of stand out or folks want to share about this? You might think too about if you were to ask some of these questions to a client that you're meeting with. Just curious general thoughts that come up. Okay, we'll tuck this away. I think it's a helpful way to make sense of well-being. And again, having, we'd call it in counseling a strengths-based perspective, a focus on wellness, not just the deficits and what's missing, but what do people have? And we can use these kind of questions, whether it's using this scale directly or just asking kind of related questions to help inform other questions that we ask, and then of course, the resources and referrals we make for clients. I'm going to hand it over to Bella here.
Okay, thank you. So when we consider mental health, a really helpful way to do that is considering it on a spectrum.
Just as physical health changes over time, so does mental health. So if you look at this spectrum and you think of it for physical health, you might consider how you might be more in the red if you're sick or if you're injured. And hopefully, most of the time, you're more on the green side. And then maybe people with like chronic illnesses, their baseline might be a little bit more somewhere in the middle. But for me, for example, on the physical health part, I had the flu a few months ago. I was definitely in the red. And since I was in the red, that told me I really needed to just rest and just focus on resting and not doing anything else. I'm sure we've all had that kind of experience before. It's similar with the mental health continuum. So, we can always consider which part of the spectrum that we might be on any day. And we can consider this with clients as well. So if they're in the green zone, that might mean that all their coping skills are working effectively. They're feeling well in different areas of their lives. If they're feeling more in the yellow zone and approaching the red zone, for them, that might mean maybe we talk about different kinds of coping skills. Maybe we consider different parts of your wellness that might need a little bit more attention. And then in the red zone, that's where a client might really be in crisis. And so that's where we might enact the kind of crisis resources, depending on their level of crisis and what they need in that moment. I really like looking at things on a spectrum. I think it's really helpful. And this kind of offers a more holistic view of mental health. Okay, so what kind of factors influence an individual's mental health? And I want to pose this question to all of you. Feel free to just shout out or you can write in the chat. Consider influences at the individual level, community level, and population levels. Okay, I see income, education, healthcare access, absolutely. Finances, housing, sorry. Social determinants of health, absolutely. Relationships, yeah. Any other thoughts? Work. Yes, absolutely. Trauma, for sure.
Weather.
Weather. Oh my gosh, yeah, it's really rainy here in Meridian and I'm feeling a little down today because of it. Yeah. Yeah, I mean, and we could probably take a whole hour and just list a million different things that could impact um, mental health. Yeah. And Sarah said financial stability, who relies on them for support, circumstances, traumatic experiences, everything around you, real or perceived. Yeah, so your perception of kind of what's going on. Yeah, absolutely. Do you want to go to the next slide, Dr. Gahouri? Awesome. Okay, so you all really hit on a lot of these. There are clearly a lot of different factors that can influence mental health. So, doctors George Engel and John Romano created the biopsychosocial framework of mental health. And it's kind of what it sounds like. It looks at mental health as a framework that is influenced by biological, psychological, and social factors. So, like I said, you hit on a lot of these biological factors that might be physical health, diet, sleep, your age. Psychological factors might be your beliefs, your values, any kind of mental health diagnoses that someone might have, their perception of yourself, perception of others, addictions, and then social factors, relationships. What are your romantic relationships like? What are your friendships like? Family. What kind of cultures do you live within? Work, of course, um, financial factors, lots of other things that we could, again, perseverate on forever, lots of different factors. Um, so now we're going to go over a brief case study So I will read this and we'll ask a couple questions, and I'd love to hear some thoughts from everyone. So, James is a 52-year-old white cisgender heterosexual man who is a resident of Middleton, Idaho. James was recently diagnosed with type 2 diabetes. He lives on a limited income and works part-time in a physically demanding job. James lives with his extended family, including his adult daughter and two grandchildren, and contributes financially when he can. While his family is close, health is not commonly discussed, and there is limited knowledge about chronic disease management within the household. Family meals are shared, and he has little control over what is prepared, which adds to his difficulty managing his condition. He has limited health literacy and little experience navigating the healthcare system. James feels overwhelmed by his diagnosis and does not fully understand how diabetes affects his body or how to manage it. He lacks access to basic supplies like a glucometer, struggles to afford medications, and reports ongoing stress related to finances and his role in supporting his family. Consider James' situation. What biological, psychological, and social factors might influence his mental health and well-being? What do you want to know more about? How might you ask James about these areas? Go ahead and just, you can speak out loud or you can enter in the chat.
I guess my first question, hi guys, this is Anna. My first question would be like, what kind of support does he have from his family that he's living with? Do they understand the diagnoses? Are they supportive or taking initiative to understand the new diagnoses?
Yeah, absolutely. Like, what kind of support might already be there that we can maybe help strengthen for him? Or what are some deficits that, we can help his family understand so that they can support him better?
Maybe we can start, that's a really great insight too, Anna. Thank you. And I'm wondering if we could start with this biological, psychological, and social factors. Um, Maybe same as y'all did before, kind of listing them in the chat or naming them out loud. What things do we know about James based on this very brief vignette here that might affect his mental health and well-being? Very obvious one, I'll start us out, right? Recent type 2 diabetes diagnosis in that biological realm. What else?
Pressure to support family, lack of understanding.
I can't help but think too how interrelated so many of these are. Like Sarah highlights that pressure to support family, and it makes me wonder about cultural expectations, his own expectations of himself. Does gender play a role in that? I see prescriptions.
Yeah, no control of preparing food, little experience with navigating his own healthcare. No control over meals, possible drug interactions, no supplies. Okay, Isabel said a biological factor needs to understand how diabetes affects his body. How can we support educating him about diabetes? Absolutely.
These are great. I'm wondering, I mean, you all are listing so many here, but again, such a brief vignette, right? What are we left wondering about? What other information are we still wanting to understand about James's situation? I'll go back a slide too in case that's helpful. what he knows. Yeah, I like that a lot. What resources are out there? Is he aware of them? Transportation.
Yeah, what does he identify as his barriers? Again, that perception piece.
Oh, I see this. So a question kind of about his social circles too, as he talked to others who have diabetes. I imagine if not, I would wonder too about more about his own feelings and is there a sense of isolation there? Does he perceive that as potentially helpful? I'm wondering too about that relationship with his daughter, adult daughter, and grandchildren, and um, the support he finds there, what that might look like.
Put this in the chat. Does he have health insurance?
Mm, absolutely a critical one. Of course, directly related, right, to the kind of resources he can access, the challenges related to accessing healthcare services. It's a good question too. I see not dis why don't they discuss health as a family? Is there something in his background perhaps or within the family's background that might perpetuate that avoidance? Bella, I'm going to transition us on if that sounds good to you. What do you think?
Yeah, go for it.
Okay. Okay. Well, thank you, Bella, and thanks, folks, for kind of thinking of that. I think it's important to think about not just what do we know about our clients, but also what's missing, because I think that idea of understanding what else do we want to understand helps us, one, eventually create a more robust or have a more robust and meaningful understanding of what the clients we work with are going through and how they perceive the world. I remember someone earlier highlighted this idea of what's going on around them, both real and how they make sense of everything, their own perceptions. And I think having an understanding of what we don't know also helps inform the assessment process. We're just asking more questions. So, what's assessment anyway? I think we can define it really simply here. Information gathering, asking people questions. We assess not only verbally, though, we also just take a look, right? And that's a form of assessment as well. What body language is this person presenting with? How are they dressed today? Who are they with? So on and so forth. Assessment can be formal or informal. I would say most of the assessment that we engage in as community health workers or counselors is rather informal. In nature. And we use assessment information to inform how we make sense of our clients, how we connect them to resources, and how we talk to them and interact with them. So I think assessment's really a foundational aspect of interacting with folks in the community in this sense. So in terms of kind of transitioning here into talking about how do we broach potentially difficult topics with our clients, so first off, I want to think just for you personally, are there any topics, and you don't have to share this, but I would invite you to take a second to think about it internally and maybe write it down if that's helpful to you. What's difficult for you to broach or bring up, ask about with a client? And you might take a couple seconds too as something comes to mind. Why might that be? And I know this could bring us down a rabbit hole, and you could probably talk about it and think of a lot around that why question. But just think about it. What's difficult for you to bring up with folks? I know some common ones I have experienced myself, or I hear from students or supervisees often, especially beginning students. I hear about I'm afraid to ask about suicidality 'cause I don't know what people are going to say, and I don't know what to do once someone answers that question. Or based on your own experiences, folks might be uncomfortable asking about issues around gender or substance use. People oftentimes worry at the beginning when they're learning how to assess. I don't want to offend someone by asking, do you use drugs or alcohol? And that is often rooted in their own perceptions of things and experiences, especially in childhood. So, kind of flipping things around a little bit, think about maybe the experiences that you've had with clients. I imagine it's going to be some of the similar things that I've already named, but what topics do you think clients have found difficult or uncomfortable to discuss? whether it's with you or maybe you've observed elsewhere. I would invite you all to share if something comes to mind here. Bad habits? Absolutely. Absolutely. There can be shame and guilt and embarrassment tied into all of those things. Criminal history, see domestic violence, income, stigmas about certain medical conditions. Definitely. And so kind of what we're segueing in here is like, what do we do with this, right? And I think this is more of a primer. This is not a catch-all explanation of here's exactly what we can do when. And I think that doesn't align with a lot of the work of working with real life people anyway. But kind of talking about, we know that these things are difficult. We know that either there's a discomfort with ourselves, but mainly a discomfort with our client, perhaps with certain things, right? So what can we do? Tips that we have for broaching these potentially difficult topics. There's a researcher, Dr. Norma Day Vines, who has done a lot of work around this idea of broaching, which I think can just be simply defined as asking about, bringing up. You're the one to bring it up. Um, and so I've adapted some of her work here today. Part of it's normalizing. We can express to clients it's okay to talk about the topic at hand, and I think broaching in and of itself does that. If I never bring up this topic of, I don't know, criminal history, right? I might be inadvertently conveying this is an uncomfortable thing. There's not room in here. It doesn't really pertain to the work we're doing. Let's not talk about it. But if I were to just broach it, I'm wondering if you have a criminal history or what your criminal history looks like. That, in and of itself, a very simple statement like that might, maybe not always, it might communicate that's okay to talk about. We can talk about that in here, and there's not necessarily going to be shame or guilt or judgment from me um, regarding the topic at hand. So expressing it's okay, normalizing it is also a part of that. Um, Something to keep in mind too is avoiding reduction of the client. So again, we're not going to get too far into it today, but based on our own past experiences, perspectives, biases, we've all got them, right? It's easy to kind of form these immediate reactions or views of people based on what they tell us. So keeping in mind that if a client shares a particular medical or mental health diagnosis, they're not just that diagnosis or that struggle or that need or that strength that they have. But again, kind of bringing it back to what we talked about at the very beginning today. Um, Having or holding and aiming to continue to build a multidimensional, really robust view of the folks that we work with. Considering the role of systemic forces, we talked to Bella explain that biopsychosocial model of things. I think it's easy. The type of bias is escaping me right now, but it's easy to have this bias that like the struggles and the issues that we all face and that our clients face, if they would have just done XYZ differently, everything would be different. And it's easy to forget sometimes that very few things are explained by one thing, to put it really simply, I think. So it's important to remember that there are social forces, systemic forces that impact our clients' experiences, their mental health and well-being, and their access to resources, just to name a few things. And as a rule, and kind of the last thing that we'll segue into today, practicing active listening that someone I know mentioned earlier, and then reflection are two absolutely critical skills, I think, to broaching and talking about difficult topics with clients. And I think when things are awkward, and inevitably that's going to happen, right? Or there's a discomfort, or you're not sure where to go next, I think we can always fall back on this skill of reflection here. Okay, so Bella's going to tell us some more about active listening here.
Okay, so active listening. This is one of those things that, we've all heard this term, but I think we don't often think about what that actually looks like and how we know if we're actively listening rather than just passively listening. So, listening to understand is characterized by a genuine desire to comprehend the speaker's perspective, emotions, and underlying message. So, it actually kind of takes a lot of work to be able to actively listen because you are sort of working in your brain on like different levels. You're working on an emotional level of considering the person's emotions. You're working on considering their overall perspective and just understanding like what is the content of what they're saying. It requires a lot of engagement. So how might the speaker know that you're listening? Some examples are you might need to respond really authentically. So just giving your genuine response to what someone just said shows them that you're actually engaged with them. You might take mental notes. So you might sort of pin something in your head of something that a client said to you because that feels important to their overall narrative. You might be considering how the speaker feels. This is, of course, empathy. Considering what is like the whole underlying feeling or feelings that are coming with what the client's talking about. You might pause before responding. Um, are there any other thoughts on what active listening might look like? How do you show that you're active listening? Let's see, we have some things in the chat. Oh, Ryan had a really good comment about reducing the client to just reminds me that language matters in how we refer to people too, like a person dealing with, a person living with, rather than an addict or mentally ill. Yeah, thank you for saying that, Ryan. That kind of like person-centered language, person-first language. And then it looks like Shalana said, I always try and use supportive listening and utilizing high empathy using motivational interviewing. Yeah, absolutely. What are some other ways that we can show that we're actively listening to someone?
Body language, and also I was just I'm not good at this too, but especially in online environments, where your eyes are in the camera, and it's easy to see if you're working on other things while someone's talking to you, and so yeah, all of those nonverbal cues can really convey listening.
Yes, absolutely. Yeah, are you making eye contact? Or are you even facing the person? Yeah, that kind of is a great segue into our next part, the solar model. So this model is used to convey attentiveness and engagement to the client. So Egan's three-stage model includes three questions that we can use to help uncover and better understand what our clients are talking about. Um, and of course, there's a lot that goes on between these questions, but when you're talking to the client, these are sort of the three phases that you might think of. So first, identifying what's going on. So that's you identifying as a helper and also helping the person that you're helping understand what is going on for them, helping them use language for that. What does the client want instead? What would be an alternative? What do they wish was happening instead, rather than what they're telling with the problem that they might be going through? And then how might the client get what they want? What are kind of some solutions that we can brainstorm with the client? And how do we get the client to identify that for themselves? And then this is the solar model. It's all about body language. And again, this is just a model, so it doesn't mean you have to sit like this the whole time, but it's sort of like a base. So the first, I'm actually going to show you guys what this looks like if you can look at my little screen. So I'm going to move my laptop. So the first part is sitting squarely. What that means is I'm kind of like a square. I have both my feet on the ground. I'm not like crossing my legs, sitting back. Again, that doesn't mean that you can never cross your legs. It just means that this is going to show that I'm being attentive to my clients. Of course, an open posture. I don't want to be sitting back and like crossing my arms because that shows that I'm really closed off. So open posture, leaning forward, and you can really time these leans with what your client is saying to show that you're really engaged. So maybe if they start launching into a story that is really impactful for them, you can just lean a little bit more to really show that you're with them. Eye contact. That does not mean that you necessarily have to be like staring your client down, but ensuring that you're giving them enough eye contact so that they know that you're there and engaged with them. And then relaxing. Of course, we don't want any of this to be like really, really uptight because that energy will sort of be mirrored by the client. And so if we are showing a relaxed posture, then that can often help our clients also feel more relaxed. Okay, so going into different ways of reflection. Reflection of feeling. This is used to reflect emotion back to the client. So pretty simple, but sometimes more difficult than you might think. So first, you want to identify the emotion that the client seems to be expressing. So as you're listening, you might be thinking like, okay, if I'm looking at the feeling wheel, it sounds like they're sort of in the sad pie. Um, and sometimes you don't even have to get any more granular than that. You can just say to the client, you feel sad. And of course, convey it with empathy and with warmth. But sometimes that is enough to get a client to understand how they might be feeling.
That's a great overview, Bella. I think I'm looking at the time here, and time flies when you're having fun, I guess. So I'm gonna transition us on, I think, to this really brief, like, let me share again with sound. I might have to just do this. A really brief video here where we can watch what appears to be a medical doctor practicing this reflection of feeling with a client who's upset about a patient who's upset about something.
I'm sick of it. I feel like everyone here knows. I feel like the people at the front were annoyed at me.
Feeling that the staff was not nice to you and you're feeling pretty terrible about it.
Yeah, I mean, they don't know me. They don't know what I've been through.
Yeah, you're angry
Yeah, I am.
and sad too.
Yeah, I mean, I already feel like shit for getting pregnant when my life is just already a mess.
Mad at yourself too.
I am. Yeah, I am.
Can we maybe talk about why you feel like your life is a mess?
Yeah.
I mean, just like Bella beautifully showed us there in her demonstration, the solar model, right? She's leaned forward, she's listening to the patient. Some very simple reflections of feeling in there. You feel sad, you're mad at yourself. She showed that she heard this person who was upset. She engaged with her. She seemed very genuine, I think, as well. I think sometimes it's difficult to convey that genuineness in these kind of mock videos or sessions that we watch sometime. But I think she did a decent job in that video there of not denying her feelings. She didn't ask her closed questions. She didn't just pepper her with question after question after question, but rather she just sat with that content, exactly what was happening in the moment, conveyed that she was listening, and I think seemed genuine while she was doing it. Um, Again, time flies. I think we have just a couple of minutes here. We were going to have you go into some small groups and talk about this, but I think given the number of folks that we have, um, we can just stay in the large group together. I know some folks turn their cameras off. If you're in a spot where you might be able to rejoin us, we invite you to come on back and do so. We just want to take a little bit of time while we have several of us here together to kind of talk about the resources that have been most useful to your clients and in your practice, just so we can do some resource sharing with one another and share our knowledge and what we have. So I want you to take a couple seconds, think about the things you most often share with your clients. Maybe someone told you about this, maybe you discovered it yourself, or it's common practice wherever you work. But I'd like you in the chat to identify maybe three if you have them, but just as an individual, one or two most useful resources that you've shared with your clients. You go ahead and add those to the chat there, and that'll be helpful for us as we kind of try to gather all of these different resources. I'm curious to see what everyone has in mind. What is this? I see virtual mental health resource for intensive outpatient cares, Charlie Health. Isabel, can you tell us more about what that is?
Yeah, so they're just like a fully virtual like mental health resource. I think it's like a 13, maybe 16-week program that clients can attend. They'll do like 3 group sessions a week and then also do like individual sessions. So that's been really helpful for my clients just because a lot of them have like transportation barriers or just really difficult schedules to like work around. So I found that that has been probably one of my most successful mental health um, like referrals that I've used in the past.
That's great. Thanks. I saw someone else put that in here as well. That's great. I'm thinking also just for any clients who have transportation issues, rural communities, sounds like a great resource. See a walk-in clinic, Health West, Family Services Alliance, 988, findhelp.org, 211. I see another glowing review for Charlie Health. This is awesome. I haven't heard of that before, so this is fun to see. Workplace info, yeah. Yeah, Nazarene Church is a walk-in clinic. That's great to know. I think people don't realize the number of different places they can receive free or low-cost mental health services. They're not always well marketed. So the VA. Excellent. Well, we appreciate everyone's time today. If you've got other resources, certainly keep them coming. But again, thanks for giving us some time out of your afternoon. This was fun.
Yes. Thank you so much, Alex, for facilitating this, Bella. Really informational. I think just as we wrap up, I know some of you probably have to go. It's the top of the hour. So I just put a link for the evaluation to the chat. You guys don't mind clicking on the link, just taking the evaluation. And we really appreciate everybody's time. And keep an eye on the YouTube page and our newsletter. We'll post the recording from this session. So if you, as you were watching and listening and learning, thought of somebody that wasn't able to make it today, that you think that would benefit from the information that was shared, we would love for you to share it. So thanks, everybody, and have a wonderful rest of your Wednesday. Thanks, guys. Yay, and we'll hopefully see you on Monday if you can make it to the Learning Collaborative in Boise. So we'll be there. Bye.
Like Jenny, Shalana, Debbie are all gonna be there, so it's gonna be a good
Woohoo!
time.
Thanks,
Yes, I'm
guys.
super excited. So I'll see you guys in person on Monday.
Yay,
All
we
right,
look
good.
forward to it.
Bye,
Here's
guys.
Shalana.
Bye. All right, I'm gonna.
Isabel.